I just want to go over the Peri Care. Okay, the sequence for the Peri Care. I'll start with okay, so for the female, just guide me through the sequence. So of course you have two cloths, always one to wash, one to rinse.
7 from
Very good. So starting from where? The
pubic.
pubic. Okay, so you come here and you go down. Okay? And you see the surface, it's a flat and it's a big surface. So I'm getting a lot of the skin surface in just one swipe. I'm getting some of the inner thigh, I'm getting the groin, and even getting some of the vagina as well. So 7 on one side, then
Change side of the towel.
change your surface.
Do the other side.
Very good. And in reality, you may need to do this side, however time on the other side, how many times you feel to get it clean, right? It doesn't just have to be one stroke, but for evaluation purposes, as long as you do the sequence at least once, so I can see that you know, that's fine. So, again, there, change, there, what's next? Okay, not middle,
Labia.
labia,
Majora.
majora. So again, I'm changing my surface, and then I'm doing labia majora,
Change
change
side.
surface,
Other side.
majora.
Change. Turn.
Very good. So now I'm gonna open up, flip it. What do I have to do first? Open.
Open.
So open. Then you're going
from the top
to bottom. So menorah,
Change side.
menorah, and then down the middle. Okay? So a big surface. Remember I said, try not to poke your finger out like this because that's a bit invasive. You have more of a flat surface and you just come down.
Or the karate chop.
Or the karate chop. Very good. That's for like, yeah.
The
That's for
majority.
your, yeah. All right, so that's for your practicality when you're in, all right, so you go down the middle. Okay, so that's the female. Now the male, because you don't know who you may have, which one you might have during the, so you need to practice both,
Ooh.
okay? And just be aware, your scenario might say Mrs., but you might end up with a Mr. Hart, and vice versa, okay? All right, so male, what's first?
The
The
glands.
meatus.
The glands, the
Expose-
meatus,
Yes.
okay? What do I have to do
Expose
first?
the glands by
Retract
pulling the
if it's
person.
not circumcised.
Very good, if the patient is not circumcised, then you have to retract. All right, and sometimes you may need a little bit of hydration. I was gonna say hydration. You need to wet a little bit, so you can take a little bit. Don't squeeze out all, and just wet the glands area just to loosen it up a bit. So you're pulling back, or retracting the foreskin. All right, and then you're cleaning the meatus. So you're gonna go around like this, right? If you need to do it again, change, which you probably will, change surface and go like that. When you pull back, what are some things you're looking for in terms of your observations?
If there is redness.
Any redness, any irritation, any buildup?
Yeah.
All right, sometimes if the patient has not been washed well, meaning if they're not circumcised, not retracting the, if their foreskin has not been retracted, you'll be surprised, horrifically surprised what's laying underneath there, okay?
Would you say smell too?
Yes,
For the cystitis?
yes, odor as well, all right? There may be a slight abnormal odor, But if it's very foul smelling, well then there's an issue. And then if it's foul smelling, there's probably other stuff there to indicate that something is going on. Okay? So retract, circular motion, change, circular motion, then
The shaft.
the shaft. Okay? So down, changing sides each way. So 4 is good enough, right? Each time changing sides. And then,
Push. Change the side.
Change the side.
And the
what's next?
The pubic.
You're number 7?
7.
Okay, very good. So pubic, groin. Pubic, groin. Then,
the scrotum.
and then the scrotum. Okay? So scrotum, and then normally you should be able to hold up the scrotum and also clean underneath.
Perineal.
Okay, or the perineal, yeah.
Perineal.
Okay, good. All right, so one more time, because sometimes the female is more straightforward, I think, right? So, wet, retract,
Retract meatus.
circular motion, change sides, circular motion if you're gonna do it more than once. Change your surface, shaft,
Change. Shaft. Change. Shaft. Seven.
7, that's right. 7, 7,
Change. Scrotum.
and then scrotum on top,
Change.
and then underneath. Good. So wash, rinse, same sequence, and then for both, you're just pat drying. And remember, for the male, you have to retract or put back the foreskin. Okay? Good? All right.